So I think as we wait for Dr. Peter to just arrange his sound and his end, I'm just going to walk us briefly through what we're going to discuss. It's going to be pretty straightforward. The key area of topic for today is going to really be the effects of COVID-19 on the rural healthcare systems in Uganda. And our key focus is going to be really mostly from Kiwoko Hospital's perspective, because we want to understand, a lot has been spoken about in regards to COVID-19, but we've never really gone down to actually understand how did it, one, impact the rural sector, but then two, how have people who are working in the health community in the rural sector, how have they managed to get this, So the goal for this discussion is going to be centered around that. I'm going to let Dr. Peter get started. He's going to walk us through really Kiwoko Hospital and how they've been, how it's been working so far, what they have done, and how they've actually been managing through the COVID period. The presentation won't be too long. I believe Dr. Peter should be taking about maybe 10 minutes, 10 minute stops on his presentation. And if you have any questions, like I had said earlier, do feel free to drop a text or just put it on the chat here, so we can then share and then answer those questions as we proceed. So with that said, Dr. Peter, back to you.
Ronnie, thank you so much for the introduction. Members, once again, I just want to apologize for the delays that we've had in starting. But it's great that we have so many people with us today. My names are on the screen, Peter Serwadda. I'm the medical director, Kiwoko Hospital. And that long line underneath is some of the qualifications I have. I am a doctor first, and later trained as a surgeon, and finally trained as a urologist. I've been in Kiwoko Hospital now close to 20 years. And it's been a lovely experience. I've learned so much, and a lot of what we'll be sharing today about some of the history will be personal experiences that we've gone through, and things that we've seen happening, and services that we've seen starting. And a lot of this has contributed to making us what we are today. So, for those who do not know Kiwoko Hospital, I have started with a simple map just to show where we are in Uganda. And the Kiwoko Hospital is in southern Nakaseke district. So if you follow Gulu Highway up to Luwero, it's about 14 kilometers off the highway. And this is about 86 kilometers from Kampala city. We are based in Kiwoko Town Council, which is a thriving town of about 13,190 people. And we are in what we call Chikamulo sub-county. This is one of the geographical divisions of or the political divisions of the country. And this area has about 21,000 people. So according to the district, these 21,000 would be what we would call our primary catchment area. But as we shall see later in the presentation, our catchment area extends much beyond just Chikamulo sub-county. And it extends to the Greater Luwero area. And Greater Luwero, if we look at the map and you can see the cursor moving, that is Nakaseke district, Nakasongola, and Luwero districts. That's an area which is quite large, and it has a population of close to 1 million people. And this is a largely underserved area. It's a pity we've not been able to have Dr. Ian Clark with us due to connectivity issues, but his main reason of starting the hospital in this area was because it was hard hit in the civil war which we had in the early 80s, between 1980 and 1985. And when he came to the country in 1988, his heart was moved, specifically for this area, which was badly hit, and there was a lot of hurt in that area, a lot of devastation. For the Ugandans who remember those very bad pictures we had of piles of skulls which used to be at the roadside, which were just the remains of a very badly hit area by the Civil War. And so that is just a little bit of background of where we started and why we started. And the hospital started under a mango tree initially. And it started just as a post which was providing service to the people of the community at that time. And it was in partnership with the local church, St. John's. And from there, it rapidly grew as support was garnered from all over when the need was realized in that area. And very soon, the hospital, from its inception in 1988, became a dispensary. And by 1991, it had been licensed to be a full-fledged hospital. So actually, this year, it is 30 years since we were licensed.
Mm.
So who are we today? Now, today the hospital has developed quite rapidly, and since its origins, when it was started by Dr. Ian Clark, the ownership has now been handed over to the Church of Uganda. That is in this first box of ownership. We are what we would call a private, not-for-profit hospital. And for those who are not familiar with the terms, maybe the opposite term would be a private for-profit hospital. And it's probably a difference more in terms of organizational culture. That's why the two terms have evolved. And in a simplistic way, would say that a private, not-for-profit hospital aims to give service first and business comes later. Whereas in the private enterprises, it's more business first and then service later. So that is very simplistic, but that is an overview of what a PNFP unit would be. We're also part of the UPMB, that is the Uganda Protestant Medical Bureau Network. By size, we are a 204-bed hospital. Location is rural. We have functionality, which means we're teaching, we're a community health unit, and we do acute care. We don't treat many chronic illnesses on site. We have various specializations, and the four major ones are pediatrics, internal medicine, obstetrics and gyne, and surgery. And this is just showing our leadership structure as Kiwoko Hospital. Right at the top, we have a board of trustees of the Church of Uganda, who is ultimately responsible for all Church of Uganda hospitals. And under this, we have a patron, we have a board of directors, and then at the hospital itself, we have an executive team of 5, who are also part of our senior management team of 12, and we have a staff of 397 staff. We have various implements which help us to govern the unit. We have a constitution. We have a 5-year strategic plan, which is running until 2024. It's recently been started. We have annual licensing with our Medical and Dental Practitioners Council. And we're audited by Chisaka and Company on a yearly basis. Now, today the hospital is divided into various administrative units. Some of this you may have heard from the video. So we have an inpatient department, an outpatient department, community health outreaches, and the KHHTI stands for the Health Training Institution, which is offering 3 programs at the moment. We train midwives, we train nurses, and we train medical lab assistants, all at a certificate level. And finally, we do also have some income generating activities. Much as we're private, not for profit, we are not private to earn, not for profit to earn losses, to make losses. And so we need to see that where there are gaps, we have some income generation, and we have a training center which has been set up. The farm was shown on the video, and a guest house which houses medical students who come on electives from all over the world. Our staffing levels, we mentioned we have 397 staff, and these are generally divided into two groups. We have medical and we have non-medical staff. The medical staff, we have some specialists, and we've been very fortunate to have a team of 8, many of whom are locum or part-time, but others like myself are full-time members of staff within the hospital. We have a number of doctors, nurses, midwives, and other paramedicals. And we're supported by a robust team from the finance, the admin, the estates, and other departments. Now, as a snapshot, as we are looking at COVID today, we would love to present what our picture was before. Very much today, with COVID, we're hearing of a new reality, but we need to take a look at our old reality to understand where we were coming from as we entered into this new reality. And as of 2019, this was our position. We were having roughly 70,000 outpatients and inpatients who came to visit the hospital in that financial year. And we had 2,500 surgeries which were performed. We had 2,797 births. And we had a large number of mental health patients who came. The majority of these were patients who had epilepsy of various types. And we were very surprised because that clinic was only about 2 years old by 2019. But the numbers mushroomed very, very greatly, with people coming from great distances, from Kampala and even beyond, just to receive services for epilepsy. As we mentioned, we have an outpatient department, and this figure is showing some trends in this outpatient department. And we've had attendance, which is reflected in the blue line at the top of the screen. And on average, we are seeing about 30,500 patients on an annual basis. This would come to about 84 patients per day. And we are having this watershed area marked by this black line, where initially the trend had been downwards. But we realized that there was an issue with the infrastructure of the outpatients, and we had to refurbish the outpatient department. And as we can see, the numbers of patients have quickly rallied and climbed upwards and are back and even exceeding what the previous numbers used to be. Now, the numbers below in the red are showing the admissions at the hospital. So the trend has been steadily rising over the years and has reached about 10,000 admissions by annum by the time COVID found us in 2020. On average, that would mean that we're admitting about 22 patients per day. We have a number of specialized clinics. This graph is showing those specialized clinics which are in the hospital. And a clinic is basically an area, it can be a department, or it can just be a time where specialized services are given to groups of patients. And this allows us to concentrate on that group of patients and cater for their needs in a special way. So for example, the HIV clinic, which is number 1, is a 15-year-old clinic. It was started in 2005 and currently has 1,909 adults in it, 138 adolescents and 79 children. and it runs from Monday to Thursday. And we have been fortunate to have been able to open up to 11 of these clinics in the hospital to serve the community. Now, one of the big clinics, a lot of emphasis in the country is on our fertility issues. So one of the big clinics is the antenatal clinic. And this graph is just demonstrating the fluctuations in the numbers. 2019, 2020, we can see a drop from where we were previously. And this is factoring in how COVID has affected us. So we'll be talking a lot more about COVID in this the coming presentations. But this is sharing where we are at the moment and what the trends have been like. And these are admissions by ward. As we can see, this green line, which is showing a trend right at the top. If you can see the cursor which is moving on the screen. Now that one is representing our maternity ward. And we can see that the numbers have been steadily increasing. And in general, those numbers are probably twice or sometimes even thrice the numbers which are received in some of the other departments. Alternatively, these other four lines which are below, the light blue, the red, the blue, and the purple, are representing our other wards, that is the male, the female, the pediatric, and the neonatal intensive care unit. And these ones by 2018 had almost similar admission rates on an annual basis. Now going in a little bit more about maternity, because this is where a lot of the hospital's work is. We can see the maternity admissions at the top. And we've put another black line, which is showing where we were able, with the assistance of some partners, Adara, to start a new ward. And you can see what has happened to the numbers. They literally shot into the sky after we opened that new ward. It's a 65-bed facility. And the line below that is the normal deliveries. Again, the normal deliveries are following a similar trend to the admissions. And finally, right below, we're seeing cesarean sections. And cesarean sections, again, the numbers are steadily increasing. And what we have seen is that in this region of Greater Luero, which we talked about, we are a referral unit for very many lower level health units in the district. This area of Greater Luero with the 1 million people has only about 4 hospitals, private as well as government in it. And so there's a huge burden of care to each of these hospitals. Now this one's reflecting maternal deaths. We don't usually want to talk about deaths, and we, as much as possible, try and avoid them. And as a country, we are having very stringent follow-up of each maternal death. So we try as much as possible to minimize what is happening. We are grateful to God that we haven't had many, and some of them are a challenge because we have patients who may be referred to us who are a little bit beyond what we can actually salvage. And that contributes to some of these deaths. 75% of the deaths as of 2018, 2019 were related to problems due to high blood pressure. And the remaining 25 were due to bleeding issues. Considering the 10-year period from 2008 to 2018, we tried to get a rough or a crude, what we call a maternal mortality rate. This is the number of mothers who pass away for every 1,000 babies who were born alive. And we calculated this one just for the hospital to give us an idea where we're standing in terms of our maternal mortality rate. and our services. And if we look at to about 226 maternal deaths, those 10 years from 2008 to 2018, and be reflected with the targets below and the values below. For Uganda, the maternal mortality rate in 2016 was 368, whereas the WHO is recommending that we should be aiming to see that we have less than 100. So much as we are a little bit ahead of what is happening on the nationwide basis, we still have some distance to go to hit the WHO recommended targets. This is just reflecting cesarean sections. This is just as an example of some of the surgeries that are happening in the hospital. And cesareans actually the major type of major operations that we do in the hospital. And our cesarean section rate, which is reflecting the number of cesareans done out of the total deliveries, came to about 27.7%. And this is a little bit above what WHO recommends. Our referral position in the district, we have some people who are just sent specifically to have operations at the hospital. And Kiwoko happens to be their hospital of choice or their nearest hospital. So for whatever reason, we get a lot of complicated pregnancies coming to us. Now we mentioned also our CBHC activities, and the CBHC department was one of the very, very first departments started in the hospital, and it started way back in the late 80s, 1988, and it was targeted at helping to target the diseases right in the communities. And it was realized from the outset, when so much devastation was seen, that emphasis had to be placed on prevention, rather than hoping that everybody would be coming to the facility to be cured. So today, some of the services include vaccination, which is one of the major ones, advice on nutrition and sanitation, home visits for those who are having various health issues and need follow-up, or people who have failed to come to hospital for appointments. We also do health talks on topical issues. We provide antenatal care in the community, and this is because we are trying to minimize the dropouts from antenatal care at the facility. We are trying also to offer drug refills, and this started way back, even for because some people would miss appointments. But this was a service which was much emphasized in the time of COVID, because again, we remember the issues which came with the lockdowns and the challenges with transport. So refills became a very significant issue. And finally, our epilepsy and mental health clinic is also part of the CBHC program. A lot of these people are treated on an outpatient basis. And this is reflecting just the vaccination program. What I will say is that our vaccination program has contributed to a lot of the success at the district level with vaccinations. And we are grateful that as a district, we have very high vaccination levels countrywide. And these some years it has actually been closer to 90% people who are being vaccinated. Now, in summary, as we are talking about impacts, we can consider what have been some of the impacts of the hospital, at least in the time prior to COVID, but even going forward. And these are some of the major things. We have been able to provide healthcare. not just to the local, but people from much, much further away from the hospital. We have been a referral unit for the Greater Luero. We have been able to train healthcare workers for the workforce both within the country and outside. And we have empowered households and communities in the area to take care of their health. Furthermore, we have been able to respond to epidemics in the area. And we shall be having a lot more about what exactly has happened in the hospital and in the community as a hospital to respond to COVID-19 in some of the coming discussions. But our efforts to respond to epidemics started way back in 2011 when we had a first outbreak of Ebola in the Greater Luero district, or the Greater Luero area. And this has been followed by CCHF, or Crimean Congo hemorrhagic fever, as well as COVID-19. We have also contributed to the development of the area in terms of employment, education of both the local people there within the hospital. A lot of the community has benefited from the education in the training institute. We have provided community health insurance, and there is a scheme called Save for Health Uganda, which is now present in about 8 districts, which had its inception in Kiwoko Hospital 20 or so years ago. So the impact of the hospital has really been quite great in the community. We are actively involved in spreading the gospel, and this is both within and outside the hospital. And we have a Bible Institute, which is organized on an annual basis for various people who want to have further training in ministry. And in general, we are helping Uganda meet Millennium Development Goals. Now, finally, I just want to end with this statement, which is part of our mission. And our mission is to be a rural Christ-centered health facility providing affordable and accessible, curative and preventive healthcare for holistic healing for the poor and vulnerable, reaching out to the communities in partnership with individuals and institutions of like mind. And I just want to emphasize the word partnership. And the partnerships have been largely responsible for a lot of the success of the unit. Thank you, Ronnie.
Hey, thank you very much, Dr. Peter. This presentation has really been insightful, and I think for me, really, I have actually been to Kiwoko before, but still, just from your presentation, I have gotten a lot from it. For instance, it's actually a wonder that you've been in existence for 30 years. And when you say you started under a tree, and to look at where it has gone now, it's exciting to to imagine where it's going to be in the next 20 years or the next 30 years from today. I particularly noted some of the things you were talking about, especially in regards to handling about 70,000 outpatients, and or an average of about 84 daily patients. And it kept resonating in my mind, and I'm thinking, okay, so if that has been what has been happening over the past few years, since we all know that 2020 got very tricky, 2020 had its own, it came with its own challenges, and biggest among them was COVID-19. So I'm just curious to know, and I think this is where the next speaker is going to come in from. How did COVID-19, how did it affect the flow of Kiwoko Hospital?